Hi, I'm Dr. Maria Early A. Villanueva. I'm an obstetrician gynecologist, and I'm here to answer your questions regarding Polycystic Ovary Syndrome, also known as PCOS. Polycystic Ovary Syndrome is the most common endocrine disorder which affects women of reproductive age groups. It encompasses a wide spectrum of complications in certain health aspects, such as reproductive, and this includes menstrual irregularities, hyperandrogenism, hirsutism, anovulation, and infertility. Metabolic factors, which includes increased risk of diabetes and cardiovascular risk, as well as psychological factors, which include mood disorders and decreased quality of life. The symptoms of polycystic ovary syndrome are menstrual irregularities, that is, menses or the menstrual interval would occur more than 35 days, and they also present with clinical signs of hyperandrogenism, which are hirsutism, wherein these patients have excessive hair growth on the face, the chest, the abdomen, the back, and they also have alopecia, which is thinning of hair or loss of hair, and also patients present with oily skin as well as acne. The major cause of polycystic ovary syndrome is unknown. Most experts say that there are several factors which causes it, such as insulin resistance, but genetics really play a role. Like, for example, if the mother has PCOS, there is an increased tendency that the children will have it too. Unfortunately, there is no cure for polycystic ovary syndrome, but the symptoms can be managed. And this includes menstrual irregularities, infertility, hirsutism, as well as insulin resistance. The treatment of polycystic ovary syndrome focuses depending on the individual concerns. Low-dose oral contraceptive pills is the primary or the first-line pharmacological therapy in patients with menstrual irregularities and clinical hyperandrogenism such as hirsutism. Metformin can be given in combination or alone with these low-dose combination oral contraceptive pills, particularly in patients with metabolic features such as with an increased risk of becoming diabetic. Letrozole is the first-line pharmacological therapy in patients who are infertile. Recently, there is complementary alternative medicine which serve as an adjunct in the management of polycystic ovary syndrome. Now, there are some studies regarding it, and it's noted to have beneficial effects regarding the severity of polycystic ovary syndrome and with respect to its metabolic, endocrine, cardiovascular, as well as reproductive complications. Now, some of these include lifestyle modifications, which include eating a healthy diet, as well as regular physical activity, which causes a weight loss in these patients who are obese, as well as overweight patients. Recently, the use of antioxidants, most particularly glutathione, has attracted lots of interest in the management of polycystic ovary syndrome. Some of the characteristics of polycystic ovary syndrome, such as obesity, abdominal adiposity, insulin resistance, as well as hirsutism, can cause oxidative stress. Polycystic ovary syndrome is a condition wherein there is a significantly low antioxidant level as well as vitamins, and this would cause an oxidative stress. So oxidative stress with a significant low antioxidant level in patients with PCOS will predispose these patients to cardiovascular complications, hypertension, diabetes, and dyslipidemia. Glutathione is the master antioxidant, which means that it protects the cells of the body from potentially harmful molecules such as the free radicals. So if the free radicals accumulate, this would cause oxidative stress. This oxidative stress would damage the DNA and the important structures in the body. This would lead to cardiovascular complications as well as diabetes mellitus, and also the patient would have predisposition to develop cancer. Polycystic ovary syndrome is not contagious, but it is hereditary. which meant that if the mother has polycystic ovary syndrome, there's a greater chance that the children will have it.